Hi, this is Curtis Alexander. Today's video, what I want to touch on is the side effects that you can get from a drug called Aimovig. Now, if you're not familiar, Aimovig is one of the newer migraine medications. It's a subcutaneous injection and it's becoming more and more popular, but it does come with some possible side effects. Now, a little background. When you get a migraine, one of the things that we know now is there's a substance called CGRP that can come in. It can get in your meninges or the lining of the brain, and it can start causing inflammation, and that's where we believe a lot of the pain can come from when you get a migraine. So Aimovig is in a class of drugs that is aimed to block CGRP. So with that being said, what are the biggest side effects that can happen? Well, first of all, I want to point out that it's actually really well tolerated in the folks that I know who use it. But first and foremost, you can get a bit of constipation with it. Not common. I'd say around 3% of folks get some constipation with Aimovig. The next one we want to talk about is, it's probably the most common, is some injection site reaction. Again, it's subcutaneous injection, so you can get a little bit of, just an injection site reaction. So injection reaction. The next one we can see that's somewhat common, and it's not discussed as much, as you can actually begin to develop antibodies to the Aimovig. Now, it doesn't occur in a lot of people, probably 3 to 5%, but in about 1% of people, what can happen is they can develop what are called neutralizing antibodies, and in that case it can make the Aimovig not effective. So again, 1% of people it happens, not common, but it can happen. So neutralizing antibodies. Now, in some folks, we do worry a little bit if they have cardiovascular problems. There can be some hypertension, some high blood pressure, those sorts of things. Again, not common. I mention it just in passing, but the big ones, a little bit of constipation, injection site reactions, and then the neutralizing antibodies. Very rare on that one, but it can happen. Now, a couple of questions that I get, and I don't know why this is, they seem to be a little more common around Aimovig, is can it, in women, can it affect your periods? The short answer is no, not that we can tell. If it does happen, it's going to be very, very rare. It's not really mentioned in the literature. So I would say the answer to that would be no. The other one is, can it cause hair loss or alopecia, which obviously hits home with me. But the answer to that one as well is no. Again, the research really doesn't bear that out. Can it happen? Can it be caused by Aimovig? Sure. There's going to be some cases where stuff can happen that you don't see in the studies, but by and large, affecting periods and any sort of hair loss isn't something we normally see in Aimovig. So I would say no to that. Now, it's not really a side effect, but Aimovig can get expensive. So if you're on Medicare, you can run into issues with your donut hole, where your coverage lapses until you get to a certain dollar amount. In that case, there's programs that can help. But if you have private insurance, and sometimes what you have to do is get a prior authorization for Aimovig. It's not always paid for right off the bat by private insurance. In those cases, if you need help with the copay, Aimovig does offer a coupon for folks, and I'll put a link to that below the video. So again, Aimovig side effects, any questions, put them in the comments. I'll try to answer them as best I can. I'd appreciate a thumbs up, subscribe. Let me know if these videos are helpful, what else you'd like to see. So again, Curtis Alexander, I appreciate you listening. Thanks.